Singapore has put in place new measures to temper a surge of new COVID-19 cases in the community. The task force handling the country's pandemic response says the aim is to keep its healthcare system sustainable, even as it plans to cope with up to 5,000 new cases per day. It reported a record high 1,500 new infections yesterday. Among the tightened measures in place from Monday, group sizes for dining in will be reduced to 2 people. There will also be a 2-person cap on social gatherings and unique household visitors per day. Primary and special education schools will have their home-based learning extended to the 7th of October. And the multi-ministry task force is also ramping up hospital capacity for COVID-19 patients to prevent the healthcare system from being overwhelmed, even as daily cases are expected to surge in the coming weeks. New measures are also in place to slow the rate of daily new infections and protect the healthcare system. Cheryl Go with more.
As daily infections surge, 1,600 hospital beds are set aside just for COVID-19 patients, up from the current 1,000. But the new capacity would come at the expense of some hospital services. For instance, non-urgent treatments may have to be deferred. This is on top of existing restrictions not allowing visits to hospital wards for a month. The task force also reiterated that Singapore has the capacity to activate 300 ICU beds on short notice. 23 patients are currently in ICU, and the situation of patients who require intensive care is still manageable. But to supplement hospitals, there's a new class of facilities. They are the Community Treatment Facilities, or CTF. These are different from the community care facilities that were previously deployed. With a higher level of medical care, CTFs ensure that patients who are stable but at higher risk of serious illness are cared for with the appropriate level of medical attention and supporting equipment. 300 such CTF beds opened in Tampines, with 700 more at Expo and 200 at Sengkang Hospital in the works. Authorities will be tapping on private sector hospitals and the Singapore Armed Forces to help run them. Ultimately, these are part of plans to prepare Singapore to handle 5,000 cases a day.
We are now at 1,600 new daily cases, and as you heard just now, if the doubling of the cases continues, we will reach 3,200 by next month. At some point, this wave of infection will crest, but we don't know what the daily numbers will be at the peak or when this crest will happen. Meanwhile, we are seeing tremendous strains on our healthcare system and our healthcare workers. And that's why we need these additional measures to slow down the spread of infection.
If daily cases continue to rise exponentially, we may see a fifth doubling cycle to 3,200 cases a day within the next 10 days or 2 weeks. We will start activating the plans to be ready to handle 5,000 cases a day. Second, we will need to tap on the brakes to slow down the increase in cases, to spread it out over a longer period of time, rather than a sudden sharp increase that we don't get overrun by the virus.
The task force also acknowledged the frustrations Singaporeans are feeling by the new restrictions, but called on Singaporeans to rally and ride this out together in support of our healthcare workers who have been working flat out for the past 20 months to help the country manage the virus. These restrictions also give us time to stabilize the healthcare system and ensure that it can cope.